What thoughts come to your mind when you hear virtual and remote physical therapy? What are your thoughts and what are your experiences with insurance based PT versus cash based PT? And how should we look at that as a consumer? What are some adaptations that you've seen, utilization of technology, either in our company or just healthcare in general? What's up, everybody? This is Dr. Zach Baker of Rehab to Perform and R2P Academy. You are listening to the Strength in Knowledge podcast, and we have with us today special guest Dr. Josh Funk, owner of Rehab to Perform. Josh, we talk a lot. I don't always get to sit across the table from you and talk in person. Glad you were able to find the time to come in here today, and I've got a few questions I wanted to run through. And some of these are topics that I've seen circulating around on the internet. Some are just conversations we're having as we go through the evolution of our business, going up on, 10 years now at R2P, and some of the changes that we're seeing unique to our company and in the industry. But I would love to pick your brain on a couple of these questions while we have you here today.
Zach, it's awesome to be a special guest on a podcast. Obviously, we did a lot early on to get the roots. But happy to be here, happy to touch base on some topics that definitely are hot button ones. And I think that between you and I, just the years that we've been doing this, hopefully can provide a little bit of a both-sided approach, but also putting people in a situation where maybe they have some clarity on where some of these things fit in the greater scheme of the rehab world.
Absolutely. And the first kind of topic I want to talk about is virtual and remote physical therapy. And you're seeing this become, I don't know if I want to say more popular or just more prominent from a marketing and from an advertising standpoint, but it was a conversation we weren't really having nearly as much when we came out of school, and it's becoming a little bit more relevant. But when you think about this, one, as a business owner, two, as a PT, and also just as a consumer, what thoughts come to your mind when you hear virtual and remote physical therapy?
I think when I think of virtual and remote physical therapy, first and foremost, I think of the word convenience. They are incredibly convenient for people, patients, clients, whatever we're going to call them, who are looking for clarity on what they should be doing in terms of modifying activity and or potentially putting themselves in a position where they are rehabilitating from a distance as it relates to an acute injury, potentially a post-op situation, maybe something that's a little bit more chronic. But the convenience of the individual being able to do things in the confines of their home, potentially a gym-based facility where the provider is not with them, they're able to receive information and ideally get a program. But I think where the next word takes me is going to be the word limitations. I think that virtual and remote are going to have limitations until we're in the metaverse and we're both sitting here and maybe we've got our Oculus headsets on and we're in 3D and there's ways for me to get a better appraisal of you in space. But I think a two-dimensional look from a provider standpoint can be very limiting. I think it can be very, very challenging for me to, let's just take end feel for joint play from an individual. I think it could be very challenging for them also to be expected to have a treatment table. What are they lying on? How are they doing things in supine or prone? How are you able to dive into the nuance of a hands-on oriented assessment, knowing that not all initial evaluations are going to be that low complexity, very cut and dry situation. So yes, we have convenience, but I think also we have limitations. I think if I'm going to dive in to when I would use it, I think it's very, very applicable in situations where you have familiarity with somebody. You've been working with them for a certain amount of time. You're comfortable with their overall trajectory. Things have gotten very, very predictable throughout their course of care. Potentially there's a college athlete you've worked with throughout the course of the summer. Maybe they're going back to wherever it is that they're playing college athletics. You worked with somebody who's a snowbird. You've worked with them for a couple months, and then potentially you transition to that virtual or remote, again, because you have the familiarity of course of care, you know what's going on, and you're out of maybe that more acute phase, whether it was post-operative or an acute injury that was occurring. But those particular situations, I can say that I think you would have a high amount of value and very, very low risk reward as it relates to the ratio there. But individuals of whom are, again, having an initial evaluation from afar, I think things are going to be missed. And I also think, especially in situations where you're telling me that maybe you have a call for a period of time and you're providing programming that is asynchronous, how do you queue? How do you modify? How do you do things that are relatively comparable in the day-to-day sessions or things that are going on when you're not in person, not seeing things, not having conversation with an individual as they experience new load, spatial, tempo-based parameters that you may be potentially put in through the course of their programming. So I think, again, it just is a piece that we can add to provide optionality as it relates to delivering value to somebody, potentially getting them to the optimal outcomes that we're looking for. But with the convenience, you're also going to have limitations that do not allow you in situations where you have acute injury management going on to be as effective as you would like to be.
Yeah, and I think it's a tremendous supplement to an already established, well-run plan of care that's traditionally done in person. And I think back to COVID, when unfortunately we were kind of forced into a lot of virtual and remote opportunities with individuals. And for some instances, it worked great. For my longer term post-ops that were on the back end of things, they were largely independent with exercise. They just needed updates on program design. They needed quick visual representations of what they're doing well, what modifications to make. But there were some individuals that it was extremely challenging. And I think these earlier on in the rehab, you haven't taken somebody through something yet. And the first time you take it through, you're trying to demonstrate it, you're trying to explain it to them. There's a lot that gets lost in translation. So, like you mentioned, it can be a tremendous tool and it can be a tremendous supplement. I think my biggest issue in the industry is that a lot of times it's advertised as an either or proposition. You have to do virtual or you have to do in person, when in reality, you can probably do both of them very, very well. And this brings me into the next question that I've seen discussed in a wide variety of fronts, but it's on the topic of the transaction that takes place with physical therapy. And I'm talking about, are we using insurance or are we paying cash? And again, this is another thing, it's a very polarizing topic. One is better than the other. You have to do it this way, you have to do it that way. And I don't think that's the case. But when you hear this, what are your thoughts and what are your experiences with insurance-based PT versus cash-based PT, and how should we look at that as a consumer?
I can think of two words and one for each of those. With cash, I think of the word friction. You are decreasing friction as it relates to an individual saying that they need PT and engaging with a provider who provides physical therapy. There is a very, very clear cut, here's the price, here's the exchange of the money, here's the service. With the insurance, you have increased friction. So you have an insurance of whom needs to get called ahead of time if you want to make sure that you are being as transparent as possible with cost to the individual. There's some information then being exchanged back. There's potentially a deductible, there's copay, there's coinsurance. So there's layers and nuance as it relates to the financial transaction. And then the other word that I want to mention is the word access. You have more people who are going to naturally choose to use insurance. I think it would be very, very hard for somebody to debate that you're going to get a wider financial demographic that chooses to use their insurance. You are going to have a smaller demographic of people with more financial means who are going to choose the cash route. So friction and access are going to often be found, and obviously not concrete black and white, but there's layers there that are going to be almost in this inverse type of relationship. One could be better as it relates to a level of expertise, or potentially somebody needs more time. You're going to choose to pay more money to have more time with a provider because potentially that provider is niched down in a particular area of which that individual is seeking out services. When it comes to post-operative situations, I've yet to hear anybody say that a cash PT route is without some significant considerations as it relates to the overall financial burden. Those are just two examples. I would argue, though, that any business that is taking insurance who has to worry about things involving medical necessity or a certain amount of visits per case or visits per calendar year, you need to make sure you have a cash option on the back end. So at the end of the day, if the individual does go through this process, insurance does rear its ugly head, you still have cash pay options for individuals to continue care. I think those are situations where people paint this horror story of you're not going to get enough visits. If you go the insurance route, you're not going to be able to go through a full discharge or plan of care. Well, okay, if they can't do that on the insurance side, but they also can't do it because they don't have the financial means to do it on a cash side, what do you need? You probably need a mix of both. So then they go through the insurance side of things, and then they're potentially getting, let's say, the 4 to 6 month mark for an ACL or an Achilles, and you're in a situation where the insurance goes no longer medically necessary. Well, here is your cash base option. Then you're just choosing between two different places that potentially still have a cash base option. Maybe you're putting in some of this remote programming or potentially other ways to supplement what it is that's going on with that individual. But I think it's very, very interesting to paint this as a very, very clear-cut black and white if you're solely talking about value. I think it's a lot more nuanced. Also have to mention the fact that you even have fitness groups that are shifting towards more of a 45-minute time session. So where did we get this belief that hour-long sessions are the gold standard? If somebody can provide me with that research, I would love to look at it. But I think, honestly, we just looked at personal trainers and we said an hour must be the standard. But I know more and more personal trainers that are also shifting to potentially more of a 45-minute session. So what's best for the individual? It's just important that we have, again, optionality. Options are important to be able to present people. Every situation is going to be different with regards to resources, how much time you have with them, how much money the individual may have to make some of these decisions. And the more options that you have in the company ecosystem, the more that you're going to be able to sit here without a shadow of a doubt and say that you're providing people with everything that they need to get the ideal outcomes that you're championing.
It's always funny to me when I hear, well, if you use your insurance, insurance is going to dictate what physical therapy looks like. No, it's not. I've never had an insurance company say,
Never.
Zach, you're not allowed to push a sled with that patient. Zach, you're not allowed to do goblet squats. It's, Zach, we're going to pay for 30 visits, and when they use 30 visits, we're not going to pay for it anymore. They're still allowed to go to PT. That's just all of the visits that we as the insurance company are going to pay for. Guess what? The PT company that takes your insurance would be more than happy to take your cash as well. You're allowed to continue to work with them. So I think that's my biggest disclaimer that I put out there for people is that just because you start using your insurance for physical therapy, when your insurance benefit runs out, it does not mean that you are no longer allowed to do physical therapy anymore. It just means if you're going to continue, you need to pay for it in a different means. So I think that's a very big kind of misnomer to clear up with that.
We have less than 5% of our sessions that will get denied or that we will lose that were originally thought to be an insurance-based transaction. So this belief that insurance is denying people left and right, incredibly restrictive. No, a well-run company is aware of how to interact with the insurance system. And we're in a situation where we're able to provide cost transparency on the front end, expectations as it relates to visits for your course of care, and then again, the options that an individual needs to have once they potentially exhaust whatever it is that their insurance has agreed upon initially for their insurance plan as their contributory side of this equation. You're going from medical necessity to wellness. That is where the cash comes in. And then you're doing something that is comparable to the cash pay service or the cash pay PT place over here. But you potentially put that individual in a position where they had significantly less cost associated with it. Let's take somebody who exhausted their entire deductible, that only potentially has to worry about a coinsurance or a small copay to go through 30 PT visits because they had to get a surgery using what? Their insurance. So then they're in a situation where they're paying a small fee, and then maybe they get to a point, again, 4 month, 5 month, 6 month mark. We've exhausted the insurance side of things. If they want to go to a higher skilled PT that potentially does cash in their niche area, that again is a decision that they can make. But I will still say that the best businesses who are providing options in the insurance space, once those visits are completely exhausted, are going to always be able to continue a course of care and drive ideal outcomes.
And I'm not going to be naive and sit up here and say that navigating the insurance side of things as a business owner, especially in the early phases, is an easy thing to do. And you had mentioned friction early on. I do think that oftentimes when people are starting a business and they're trying to figure out, do I want to run a cash-based business or an insurance-based business? There's obviously logistical considerations that that business owner has where in their circumstances, it may just be more convenient for them to be a cash-based clinician. Maybe they don't have additional staff or personnel that they can use to do the insurance, or maybe they personally don't have the wherewithal or the time to handle that as well. But I often think that sometimes people put out kind of these false or exaggerated narratives about how bad insurance is just because they don't want to learn how to navigate the insurance system and how to become better educated with it. And anything else on that?
No, I would agree. At the end of the day, companies compete on process, and you decide which sandbox you want to jump into, and you decide which processes that you want to take on from a business standpoint to be best in class. We are always talking about tweaking current processes and potentially adopting new processes, and that should put us in a situation where regardless of the sandbox that we decided to jump into, we're going to win. And I've always been a believer of that. I know that insurance has its imperfections. I know that it creates more friction than a cash pay based environment. However, one of the things that we prioritized early on was that word access. We knew that we were going to have to make a sacrifice as it relates to friction to increase access. And at the end of the day, that was a decision, again, that was made almost 10 years ago.
Yeah. And as a consumer, if you're trying to figure out, do I want to use my insurance or not? You might want to look at how much you're paying every month to have those insurance benefits before you just blindly say, I don't want to use my insurance. That might be a little eye-opening as well. Josh, last question before we sign off. Technology. It is moving at a very rapid pace. It's infiltrating into the healthcare space. What are some adaptations that you've seen, utilization of technology, either in our company or just healthcare in general?
The direction that technology is going in is mirroring, honestly, a lot of the other industries. Self-service, automation, those are probably the two biggest words. And then the letters, AI. But when I think of what it's done for us, it has allowed us to have certain things done behind the scenes and require less non-billable staff. We can talk about corporate bloat as it relates to big medical systems, big PE-backed PT companies, but as a company that is still considered a small business, it is important that we continually make sure that our ratios of patient-facing professionals, front desk staff and PT staff, are at a much higher ratio compared to our peers in those areas that oftentimes grow, but then they add a disproportionate amount of back office staff, corporate staff, administrative staff. If I have to pay more of the individuals behind the scenes, that takes away money from the providers. And in a world where the ROI of medical professions is being talked about more and more, that is something that is definitely top of mind for us. Technology, automation, AI ideally will continue to make marketing easier, clinical processes easier, clerical or front desk processes, and billing processes. And we've seen those firsthand this year. Two companies, and I'll give them a shout out here, Prompt with regards to the EMR and billing side of things, Weave as it relates to our phone systems. Those are the two biggest places where the members of our team are regularly interacting with upgrades. Prompt has certain things as it relates to self-service for the patients that puts less demand on both the clerical and clinical team. There are certain things that also make documentation easier for our clinicians. And then there are things on the billing side that do not require, again, as many non-patient facing individuals to handle the billing claims. Those are some big picture items in addition to our phone system, then acknowledging individuals through the use of automated text messages, providing them with two different options of which we are either creating new consumer habits or potentially minimizing phone tag and allowing individuals to get scheduled quicker. So those are just a host of different areas. We're very, very excited to eventually have initial evaluation scheduling, be able to be done entirely by patients, and also potentially having assessment and plan done by an AI assistant that's able to look at the subjective and objective in your notes, putting you in a situation where things are pre-populated. Yes, you're going to have to review it. Yes, you're still going to have to sign off on it. But the thing that I think of with all of these is the word efficiency. We're going to create efficiencies that allow people to stay in their highest levels of genius. They're not doing tedious remedial tasks. They're not doing things that don't fill their cup up. And it's allowing them to ideally show up as themselves. It's harder for them to do things wrong. It's easier to get to whatever solution, which at the end of the day for us, it's an ideal plan of care in as much of a repeatable environment, but a streamlined and minimized friction type of environment as well.
Now, and I think anybody, whether you are a single clinic or single clinician versus a very large corporation or a business entity anywhere in between, when you talk about increasing ease and efficiency, you've got to pay attention to it. So I'm excited with a lot of the adaptations we've made with regards to tech in our company. I'm excited to really see what continues to come out over the next 5 to 10 years. Josh, as always, thank you for finding the time. I know that you're a very busy guy, so hopefully we can get you back on here sooner than later. For everybody listening, you are listening to the Strength and Knowledge podcast. If you enjoyed this episode, please share, like, and subscribe, and stay tuned for next week's episode.